Hello, everyone. Thank you all for coming. We're going to get started. So welcome to today's seminar. My name is Ryan Kern, and I'll be hosting this seminar. I'm currently a 10th grader at Troy High School and the president of iExplore Club. Before we start the seminar, here are some guidelines. The seminar will be recorded, so please remain muted throughout the meeting. Towards the end, we will have a question and answer session to address any questions you may have. If you have any questions during the meeting, you can type your questions into the chat. Today's seminar is organized by iExplore Club, and we are very honored to have Dr. Wang as our guest speaker. iExplore is a nonprofit organization dedicated to providing an extensive learning and communications online platform for youth globally, regardless of their economic background. We now have multiple branches around the world and over 900 students with 100 high school teachers teaching in 8 countries. As we founded the club during the pandemic, we saw that in this unprecedented time, there were unique opportunities to help our community and make a difference. Together, we are making a positive impact on youth internationally. For today's seminar, we are very honored and excited to have our presenter, Dr. Wang, educate us on COVID-19, including treatments, pandemic control, and vaccination. Dr. Wang is very accomplished and has truly impressive credentials. He is not only extremely knowledgeable, but also devotes a lot of his time to giving back to the community. Dr. Wang previously served as the president of the Troy PTSA and is well respected by our school faculty, parents, and students. He is very supportive in youth development, and he managed to make time for this presentation for iExplore during his busy schedule. We are very grateful.
各位来宾大家好，我是雨林，非常欢迎各位来参加今天的。各位来宾大家好，我是雨林，非常欢迎各位来参加今天的新冠病毒防治及疫苗知识的讲座。这次活动是由 iExplore 非营利组织主办，王吉成博士主讲的一个公益讲座。iExplore 非营利组织是由 Ryan 和他的几位好朋友共同创建的一个知识分享免费平台。自从去年建立以来 ，iExplore 已经有近100名成员，学生遍及全球。他们迄今组织了近100场公益讲座和知识分享活动。今天讲座由 iExplore 主席 Ryan Kern 来主持，我来辅助有关中文部分。在会议开始之前，我说一下注意事项。会议会被录像，以便于回放。在讲座过程中，请大家保持静音。如果有问题，请在聊天处的窗口把问题打出来，我们会收集问题，请王博士在讲座后期回答。今天我们非常荣幸地请到了王吉成博士来做我们的特邀嘉宾。王博士一直活跃在生物医学领域，担任了很多重要职务。他不仅有着丰富的专业知识，还一直热心于公益事业，对 iExplore 这个青少年组织也一直是大力支持。王博士还是Troy高中 PTSA 上届主席，对学校、家长和学生的沟通做出了巨大的贡献。他是一位我们大家都很敬佩的师长。
Now let's welcome Dr. Wang to begin the seminar.
下面我们欢迎王博士。
Hi, in USA, good evening, and in China, 在中国的朋友上午好。我今天的讲座呢是以中英文2方面同时做的。我现在先 share 我的 slide. Let me share my slides with you. 我分享一下我的屏幕。大家能看到我的屏幕吗？可以的啊，好，谢谢大家。Thank you. Welcome to today's seminar. I really would like to take this opportunity, especially to thank Troy iExplore Club. You know, as Ryan has mentioned, briefly mentioned about the iExplore Club, which is very amazing. So for the sake of time, I'm not going to talk about too much detail. Ryan or Yulin, would you please admit more people to join in? So I'm not going to sidetrack. Yeah. 非常感谢啊，因为这个是在南加州一个高中叫做特洛伊高中 Troy High， 那么他们的高中生成立了这么一个俱乐部。这个俱乐部在疫情期间，大概是在2020年的7月份，就有几个学生一起成立的。到目前为止，他们已经做了近100场的各种各样的讲座，他们涉及的国家有8个国家，甚至去多拜都有的。那么还有呢，他们的这个讲座呢是覆盖的面非常广。我曾经在 Troy 就是说做他们学生家长会的会长，非常有幸的跟他们学了一点东西。I feel so lucky to or honored to learn a lot of things, especially from the Troy school students and the parents. They're so dedicated to help each other. That's the best kind of gift I have ever received ever since I joined the Troy family. So today's topic, we have a very mixed audience. So I have to switch between Chinese and English, but feel free to type in your questions in the chat room. And then our moderator, Ryan and Yulin, is going to list the questions. 所以今天的讲座呢，我可能是因为各种各样的朋友都因为大家对这个新冠的疫情非常有热心很想关注，所以呢有至少是美国和中国的2方面的朋友，非常感谢大家来参加今天的活动。我今天的活动呢，今天的讲座呢，也只是分享我自己平时在工作当中然后积累的东西。我在美国，虽然我在中国是上海医科大学毕业，但是我在美国从来没有行过医，所以我没有美国执照。看一下下张 slide。我来把我的这个 slide 再往下面去。我们这个有个微信群，大家如果是给你1分钟可以扫描一下，我最后也会可以扫描的，你扫一扫 iExplorer 这个新冠这个微信群就可以了。下一张。这个是我的一个免责声明 ，so just a disclaimer， 因为我在美国不是医生，所以我讲的东西只是分享给大家，并不是作为任何的医学参考。那么我引用的东西呢，都是从网上或者别地方收集来的，那么版权应该归原作者所有。我自己只是一个个人观点，在这里我们仅是针对新冠病情做一些探讨，所以呢，请大家不要提一些除了这个健康科研方面以外，不要提政治敏感性的话题。非常谢谢大家，不要做过度解读。So a simple disclaimer: this is only for the science and COVID-19 related topics, and I'm not a physician in USA. I'm not responsible for giving you any medical advice. It's just the information I share from my personal. My information does not stand for any organization. And the copyright for the information that I got belong to the original creators. And please do not talk about too much politics. Today, we just focus on the science. So today's topic, I'm just going to give you some general overview. On my left side, I will go over very quickly about the current pandemic and future trend. And what are the common and real symptoms, how to test the COVID-19, and if unfortunately someone got infected, is there any way we can do self-treatment stay at home? And then what about one of the biggest topic and the hot topic is about vaccination. What are the pros and cons about vaccination? And even after the COVID-19 infection, whether there be even still some further symptoms or how we're going to treat that. 所以今天我的讲的内容基本上就是说讲关于新冠疫情的现状，然后和未来的趋势，常见和罕见的一些症状，如何检测，那么如何加强个人防护和集体防护，然后如何居家治疗，尤其是关于疫苗，大家可能兴趣比较浓，而且问题比较多。新冠病毒以后有没有各种各样的后遗症？这是大家比较关心的。那么我的讲座大概是前面可能花将近半个小时左右。基本上讲内容我尽量快的讲因为这个每个题目都很大，我只是讲重点讲一讲。那么下面呢，就是说请大家提问，我觉得可能提问环节可能是更有意思。So So during the pandemic, there is a lot of rumors or a lot of pseudoscience. So here I just use this slide to say, let's just trust the science and try to use the critical thinking to know which story is real, which is a rumor. So how can you tell? You got to use the critical thinking, mindset, okay, and then try to collect the fact. Everything should be fact-driven, data-driven. So 这个照片就是说，在新冠疫情期间，大家碰到各种各样的谣言，比如说新冠病毒是不是人传人，要不要戴口罩，治疗的时候羟氯喹是不是有效，然后呢，社交距离应该怎么保持，然后政府到底对这个新冠疫情的防护的执行力到底怎么样，包括有人在质疑 WHO 世界卫生组织到底做得怎么样。那么在美国和中国各个部门，比如像美国的药品食品管理局和疾病控制中心，各种各样的媒体报道主流媒体、自媒体，还有各种各样的期刊。那么我们怎么看这个问题 ？So all in all, we got to use the critical thinking. Everything should be fact and science driven rather than the rumor. Take this for example, right? You just respect a different perspective. Okay, maybe that's the fact. So everything we hear is an opinion, not a fact. Everything we see is a perspective, not the truth. So on the left side, maybe you see there's like 4 bars, but on the right side, maybe 3 bars. 这就是说有不同的观点，你站的角度不一样，所以请大家呢，就是说一定要用辨别性的思维，而且从对方的角度去考虑问题，尽量收集各种各样的证据，这样可能你看问题更全面。像这张图，左边的人肯定看这个地方好像是4根柱子，而右边人可能看是3根柱子，也许只是你的角度不一样。这个只是一个思维。我想我今天的时间非常有限，只是提供一个思维，大家也许用这个方法，有可能就是收集更多的信息得出你自己觉得比较合理的一些结论。这个类似的这个情况，这里你看只是个6，这里你看只是个9。那么你看这个地方，你同样这么一个物体，你从不同的角度看出来，这边可能是个正方形，这边可能是个圆，这边呢？这么多的鸟看的只是在这个左边，而一个鸟看的右侧。你想左边和右侧，它看的结果是不一样的，所以你要换角度考虑问题。So I just use this slide to see if you stand from different perspective, maybe you only see part of the real fact. So what is the real fact and whether it's the whole fact? We have to be careful. When we talk about a lot of discussion topics. So now I'm going to play a video. The first thing is about what is the COVID-19, how it's got infected, right? What's the general idea or the etiology of the diseases? So I'm going to play a YouTube video. It has 2 parts. The first part is about the pathology of the infection of the COVID-19. The second part is the idea about why the vaccine really works. 所以我下面呢就用油管放一个视频，这个视频大概是在7分钟。那么我这个视频呢，主要是讲2个部分。看一下啊，这个写在这个地方。哟，我刚刚让它关掉了。
Hello, everyone. While we're waiting, if you guys have any questions that you really want to have answered, please type them in the chat. We'll save them for later on after the presentation, where we'll go ahead and have a question and answer session and we can go over them. Thank you.
I'm almost ready. Give me 1 second. So I'm gonna try to share. You can do my. Can you see the screen?
No, we cannot.
You cannot, right? Okay, give me 1 second. I need to try this to the second. Okay, can you see that? Ryan,
Did you share
okay,
the
give me
screen?
1 second. So share screen. Can you see the screen now?
Yeah.
Okay. I'm going to play and make sure you can see, hear the sound. Can you hear the sound? Okay.
Yeah.
I'm going to maximize it. Sorry about the delay. So.
This is SARS-CoV-2. It belongs to the family of coronaviruses named for the crown-like spikes on their surfaces. SARS-CoV-2 can cause COVID-19, a contagious viral infection that attacks primarily your throat and lungs. What actually happens in your body when you contract the coronavirus? What exactly causes your body to develop pneumonia? And how would a vaccine work? The coronavirus must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles, which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Now, with the virus spreading in your body, how can you develop pneumonia symptoms? For this, we'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe, then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for. Whether you would develop these symptoms depends on a lot of factors, such as your age and whether you already have an existing condition. While this all sounds scary, the push to develop a coronavirus vaccine is...
我暂时就停在这。所以这个呢，就是刚刚放了一个视频，特地介绍一下这个新冠病毒是怎么感染，进入机体，然后呢打败你自己的免疫系统。它会利用自己的遗传物质。 然后呢，它用你自己就像造房子一样，用你身体里面的所有的砖头，自己造自己的新冠病毒，然后它可以不断的繁殖，主要的是阻断你的气血交换。那么，所以它的主要的侵犯的系统是呼吸系统。So the major damage caused by COVID-19 is this RNA virus, which can destroy your cell, and then it can insert the genetic material and use all the building blocks inside your cell. Basically, it's the amino acid, and then build up a lot of proteins, assemble a new virus, and duplicate it almost unlimitedly. Then it will block or destroy the gas and the blood exchange. And then the major organ that damaged is the lung system. So that causing a lot of difficulty in breathing, and then related symptoms such as, pneumonia, and then fever, coughing, sneeze, and fatigue, and muscle pain. It's not only affect the respiratory system, but also many other systems. So it's a systematic damage to the entire body. Whether you, when you got it in virus, whether you will show the symptom, the severeness of your body really depends how strong your body are. Especially the aged person, aged over 75 or 65, or with preconditions such as diabetics, high blood pressure, right? It's easier prone to get defeated by the COVID-19. So that's the cause of the COVID-19. Now I'm going to go a little bit further. 我前面就是讲的就是 COVID-19， 实际上它是一个多器官的损伤，它不仅仅是只是一个呼吸系统。我下面，那你受了伤之后，那么我们怎么去防治？下个就简单讲你怎么去防治。在这之前是要 back up one step. So the typical symptom is affecting the respiratory system, but in reality, because it damaged almost all the cells, right? Especially the immune system, a blood system. So you will cause the whole body problem, such as even multi organs, such as kidney, liver, brain. They call somebody just walking down the street and then fell down. What's going on? And then so it's just like a stroke. 有人可以看到过，有种叫路倒，好像好的，他好像这个人也没有发烧，也没有呼吸怎么样，怎么好好走在路上就倒下去？其中也有可能就是个病毒，它侵蚀的时候，每个个体差异很大，可能它只是非常严重的侵犯你的这个脑部啊或者血管。总体上来说，它是一个血液系统，尤其是微循环的障碍。那么它的机理里面还包括这个风暴因子啊等等其他东西。因为这个时间关系，我不会展开很多。所以当你说常有的一些症状，这是大家常见的，但是也有一些非常罕见的症状，尤其是在儿童当中，它往往是造成这个血液系统多部位的损伤。所以儿童往往发病的时候，它不是典型的就是只是消化系统 ，especially those children who got infected by COVID-19. The typical symptom might not be limited to the respiratory system, such as coughing, sneezing, whatever. Sometimes even because it affects multiple organs. So that's why it become very, very severe. Really depends on, even in majority of cases, the children are more resistant to COVID-19 infection. The next slide I'm going to show highlight, if you stay at home, how you're going to use different tools to prevent, again, minimize the infection and prevent spread. So this is what I have at my home. 这个是你用一些什么东西去预防这些新冠病毒的感染。那么比如说在我们家里面你可以用口罩。So that's the facial mask, right? And luckily you can have some K95 or N95 masks. Right now, more and more people say even think about to use double layer, whether it's not necessary or not. Whether the mask really has the protective effect, you have to still use the critical thinking, even the quality of the facial mask. And the way that you wear the mask really make a huge difference. 就算你戴口罩本身就可以讨论2个小时，到底是戴什么样的口罩你到那个美国的店里面去买，包括 Home Depot， 你会买到各种各样的口罩，到底哪一种口罩是最有效的？戴口罩是不是需要戴2层口罩？怎么戴是非常非常重要的。我一会儿也许有时间给你们就是答疑的时候放1、2个这个视频。下面就是这个空气的 spray，lethal spray，right？ Lethal spray and wet, the wiper. And then this is ethanol wiper. Like this one is 75% of the ethanol wiper. 这个是酒精的擦棉的。So this is a small package. If you go outside, you can use that one. 这个是小的那个非常小的，可以也是酒精然后这个是手套，然后这个是擦的。那基本上这一套东西，像我特地摆到我们家门口。So all this stuff I leave in immediately close the gate. So see, that's the switch of my gate. So this is how you're going to prepare. And this is a very unique thing I'd like to share with you. Part of it, now let's talk about the treatment. So 我们下面讲，如果说我们前面是讲怎么是个人预防，下面我们讲去治疗。As many of you are aware right now, it's the real fact right now because the COVID-19 incidence is so severe, and then all the resources in the Southern California area, especially in the Southern California area, got exhausted. Okay, 所以因为这个新冠疫情非常严重，尤其是在南加州这段时间几乎进了最黑暗的时期，所以呢，很多的医院医疗资源基本上已经耗竭了。比如说你要去住医院，你可能不见得能住到医院；你要去用急诊室，也不见得能到急诊室。尤其是最重要的其中一个就是缺氧，它没有氧气。Now, one of the biggest challenges is the lack of oxygen supply. Even you want to go to the hospital, you want to go to ICU, you might not be lucky to be hospitalized. You might still have to find a very hard time to compete for the ICU, for the bed, and even for the oxygen. So this is the slide I'm not going to share with you. I tried to do this like almost 1 year ago. So 这张幻灯呢是我差不多是1年前我就准备的。这个是一个什么？这个是个家用的或者是携带型的这个氧气浓缩机或者制氧机。也就是说，其实事实上很多的人，由于这个你必定要到医院去，主要2个原因。第一个，病情不是那么严重，大部分 almost maybe 80% of patients they do not, the symptom is not so severe, they do not need to go to the hospital. 很多病人不一定要到医院去。The second reason is that the hospital is so overcrowded, okay, and then we run almost all of the doctors, the nurses, even the beds and the oxygens. Even you go there, you might still stay in the 911 the vehicle for several hours prior you can get admitted to the hospital. And then within the hospital, there's still some rare chances you'll get a secondary infection. So that's why a lot of time the physician just give you a simple advice. If the symptom is not so severe, you can just stay at home and follow the physician's prescription, do self-medication. The self-medication, basically, so far there's no magic drug that can really kill the virus. Okay, that's the fact. That's the fact. So all the drugs, all the treatments, only anti the symptom. Okay, to release the fever, to release the pain, and then to reduce the cough. to help you maintain your, basically it build up your body to against the virus infection. There's no magic drug right now. The only magic is your body, yourself. Of course, there's different therapies, okay? And then later on I can share a little bit more with you. So this is one thing I'd like to share with you. But in order to get this in US, you have to get the physician prescription, and you have to get the insurance company to cover. Depends on different models. Like this, home oxygen concentration, the maximum like airflow, it can reach to 10 liter per minute. OK， 就这个是氧气交换量很大的这么一个家用型的叫氧气浓缩机。我也有那个视频，也许你有空我也可以看。You can just simply Google, OK, like home or personal portable oxygen concentrators, and then especially for those patients who endure very severe symptom during the transition period, I think it will be very helpful with this portable personal oxygen concentrators. They can help you maintain your oxygen supply. But when you talk about the oxygen, you still need to add a little bit of wet. It's called a humidifier. Otherwise, if you keep get that, it will damage your respiratory system again. So 有的时候需要加一点一定的加湿器在这个里面。And you have to use the facial mask and all these tubes. 所以这个是我个人觉得蛮有用的。你们可以 Google 一下。其实，在很多地方，尤其在加州，你不见得能住得了医院，但是你在家里面有这么一个备用的东西，或者是氧气瓶，或者是携带型的那种叫氧气浓缩机。The second thing is very important for personal care is it's called a digital fingertip LED display blood oxygen sensor. Simply it's called an oximeter. Okay, like here it's called an oximeter because the concentration or the saturation of the oxygen in your blood is the crucial factor. Is the crucial factor. So you have to be very careful about that. This is very cheaper. If you just go the Amazon range between like $20 to $60. So 这是一个测氧饱和度的这么一个叫用指头塞进去的一个仪器，非常非常小，大概在美国只要20到60美金。根据不同的情况，我们大家都用这个温度计，一定要测你的体温，对吧？但是这个非常非常重要，因为这个就决定你看你自己的病情严重程度。除了你自己感受怎么样，有的人的感受还不错，但是一下发现你的氧饱和度如果低于，比如说低于90%，就要特别小心。如果没记错，低于85%。It's very severe， 就是很严重，你就把这个手就塞在这里面就可以了。所以这个是这个是温度计。So oximeter and also thermometer are the two very useful tools for you to keep monitoring the severeness and the progress of your diseases. Okay, if the oxygen saturation rate dropped to like below 85, it's very, very severe indication your situation getting worse and worse. This is like an oxygen concentrator. This is portable. So for the sake of time, I'm not going to play the video. Okay, this is, you have a lot of different brands. This brand is Philips. So 这个是一个携带型的一个氧气浓缩机。像这些东西原来都是给老人常规用的，但是因为现在是 COVID-19， 所以呢就考虑你适当的可以考虑，有的很贵，大概最贵的可能到4000美金。So most expensive one like this portable, it can be as expensive as $4,000. Okay, cheaper ones like this is close to like $1,000. It's portable. The next thing is also very, very important in terms of protection. It's how to treat. This is called a proning position. If someone got infected, the most important thing is that you shut off breath, and then you still have the sputum accumulate inside your lung, and it's very difficult. Okay, so this physician, it's called Osma Refi. You can Google it. Okay, and then a lot of physicians really share this very, very important thing. I think I still need to play this video. Give me 1 second. Let me see it. Because I talk about different treatment options and the position. Okay, let me see if I can try this. Can you see my screen?
Friends and families, as COVID has become so rampant and so difficult, I am taking this position to show you what are the things that we are doing today in the ICU to help a lot of our patients. If you look at my feet, you look at my knees, my elbows, and my position. We are now in a difficult situation. We're having a hard time delivering oxygen to our patients. We are having truly hard time treating our patients with respiratory failure on the ventilators. So what I showed you is one of the maneuvers that will help you move the oxygen into your lungs and move your lung secretions. This position that I showed you at the beginning of this video helps you to send oxygen to the lower part of your lungs. COVID will attack the lower parts of your lungs, seep out fluids that is as thick as glue, block the lungs, and lead to suffocation, literally, and respiratory failure. Many studies, without a shadow of a doubt, have shown that the best way that we can deliver oxygen is we, the ICU team, place patients in a position on their stomach. Even the better position is what I showed you at the beginning of this video, where you're on your hands and your knees. Then you drop your elbows like this and you put your head down and you breathe in deep and you cough. This is called proning. Proning, P-R-O-N-I-N-G, proning position. That position, search it on the internet so you'll see even more illustrations and details, but that position is extremely effective in mobilizing all that gunk and thick secretions, glue-like secretions out of the bottom of the lungs, which is the bigger part of the lungs, out so you can cough it up. And that will recruit your lungs and protect your lungs from suffocating with COVID. The hand wash.
And then for the sake of time, I'm going to just stop pausing this one. Then I'm going to go back to my slide. 就刚才那个位置，非常重要，就是那个体位。这样的话呢，你可以保证你能有足够的呼吸，然后把痰能够排除。这个是就是也许是一个笑话吧。左边这个就是说，这个是医生，我们特别借这个机会特别感谢很多的一线医护人员。虽然这个是一个杂志封面了，实际上里面每一个小点都是很多人的这个脸。 那么另外一个也借这个机会，可能我太严肃，所以把这个讲个笑话。疫情期间最重要的就是说你来我家我心慌我去你家你紧张，所以呢暂时不要来往表示我也爱你，你也爱我。这个呢，因为大家都知道我们不需有很多的研究都在讲溯源，对吧？溯源应该就是到底病毒来源怎么样，我们不谈那些东西。 但是呢，就是全世界后来有不同的报道，但是至少大家由此认识了一个城市叫做武汉，对吧？中国武汉。So because of the COVID-19, middle city in China is called even like a middle west city in China is called Wuhan. Becomes so well known around the world, and then so people so with the creative thinking they invent a way how to memorize how to find ways to prevent the spread of the COVID-19, right? It's called Wuhan. So wash hands, use mask properly, and have temperature checked regularly, avoid large crowds, and never touch your face with the unclean hands. This is crucial. This is crucial, very difficult. Now, there's one physician, if I recall correctly, in China, he did go to Wuhan, and he wear all the guns, everything. But the only thing, he wear the glasses, and then he still become infected. He just reflect why he thought maybe the reason is that maybe he touched his glasses or face after he came back.所以就是说，这个武汉的时候，通过这个就讲你洗手，然后戴口罩，然后就说自己量体温。其实我刚刚讲要量你的血氧饱和度，氧饱和度非常重要 ，oximeter。然后你说尽量不要去聚集，对不对？然后特别难以避免的就是你不能去老是用手去摸你的脸部，你不去洗手，这个是大家很难去掌握这件事情的啊。所以我就拿这个也是举个例子。那么下面我们就简单讲讲这个就疫苗 ，so COVID-19 the vaccine, right? I have 2 slides, so either in Chinese or English. This one, let's just quickly go to the Chinese version. So 这个你们可以去看一看中文的东西，你稍微看一看，然后呢，我可能讲英文稍微介绍一下。那么疫苗是怎么回事？这个话题要讲，可能讨论起来 professional 的角度，至少1个礼拜，大家也不见得能讨论出来。至少在美国，为了审批2个疫苗，专家委员会各花了整整2天时间，对吧？就是 FDA 的他那个专家委员会，辉瑞疫苗花了1天，然后麦当劳疫苗又花了1天。那他们那个书都是上千页的材料去看，所以我们不可能在这个时间很快就能够讲得很清楚。我只是大概告诉大家一下，那就是说在美国或者欧美国家，现在主要是叫 mRNA 疫苗，那么这个是他们的整个过程小节。那么他们研发了这个疫苗之后，这2个技术是非常相近的技术。我本来跟你说雨林说可能讲这疫苗研发故事，我就很快的讲一讲。疫苗研发的时候，当时是一个很著名的科学家，实际上他在这之前一点都不著名，他是从匈牙利过来的一个女生，如果没记错，她当年是在30、40岁的时候，那么她就对这个mRNA 这个技术特别有兴趣。完了之后呢，我把这个改成那个上一个，我看看，这样的话那个英文的朋友能看得到，对，这样。So this is a comparison Pfizer and Moderna and Oxford AstraZeneca. These 2 are the mRNA vaccine, right? This is not. This is called a double-stranded DNA vaccine. Okay, they have used different vehicles to contain different part of the, the virus. I'm not going to go to too much detail, but I'll go a little bit quick in Chinese to share how the vaccine mRNA vaccine technology was developed. 所以那位女士我现在名字也翻译出来也没有太大意义。那么她后来呢，在匈牙利的时候，当时还是东欧国家，那么经济也不是很发达，她找了个机会，就很早的时候就移民到了美国来。那么她就做她实际上在匈牙利的教育是非常好的，她当时受到了很好的教育，但是她为了发展，她到了美国来，她到了其他州，后来就到了著名的宾州大学，然后做科学家。他做了将近至少是20、30年，有人说40年，他的技术没有人能够认可。后来是从美国国立卫生研究院有一个研究员偶然一个机会在宾大碰到他，他说我这个技术将来会有用，然后他们2个就成立了公司，几经周折，反反复复，然后他们就把这个技术平台研发出来。后来他做了这个麦当劳的研发副主管，这是这么一个故事。你可以去看这个故事，就是说，这个先进的技术一定要靠非常厚实的基础研究才能出来。那这个我们不谈太多。那么这个辉瑞疫苗和麦当劳疫苗，他们的技术都叫 mRNA 疫苗。什么叫 mRNA 疫苗？讲得很深的时候是太难了，待会那个video 也许可以给大家稍微看一下。总体上来说，这个只是就相当于什么？就相当于比如说您在中国，我在美国，我发一张照片给您。然后呢，您在中国，你看到这个照片说，哎，我的生产能力很强，我可以拿到这个照片，可以给你说做出一个杯子来。所以你这个 mRNA 本身就相当于照片，它本身没有太多的毒副作用。总体上来说，当然具体细节里面有很多的细节。那么你到中国去的时候，你拿了这个图纸，你的技术发达，你用你自己的一些原材料，是身体里面就能够合成这个新冠病毒的这个刺突蛋白，叫 S 蛋白。只要有了这个东西，它就相当于你身上有个激光枪的标签。你有个激光标签，那别人一看，哦， 晚上如果灯一打一亮了，他就知道你身体将来再有这个病毒来的时候，你身体就培养了这个抵抗力，下次他再来，因为他就认识它了。所以 mRNA 疫苗本身根本就没有完整的病毒成分在里面，它只有病毒的蛋白质和这个核酸部分的一种蛋白，就是这个刺突蛋白 S 蛋白 protein。所以说它本身你打到身体里面，你不要以为你自己接触了病毒，你真的没有接触过病毒。那么为什么它有一些毒副反应呢？大部分可能都是它的一些辅助剂啊。那么在历史上各种各样的疫苗，我们接触很多，像乙肝疫苗，对吧？还有什么脊髓灰质炎疫苗，各种各样的疫苗，它原来的技术都差不多。中国大陆目前也有不同的研发平台，但是中国大陆目前据我所知做的比较多的就是灭活疫苗。那灭活疫苗就是它是真的病毒本身，它用各种处理的办法，它研发的时候也蛮难的，但那个技术比较成功。那么它呢，就是你接种的灭活疫苗，它是病毒本身，但是它也没有活性，这一点就是你要通过很多的实验去证明它。所以说相对来说呢，那身体就认到底是那个病毒的一个蛋白质，这是其中一部分，还是认这个灭了活的病毒。然后你身体里面就各种各样的免疫细胞，比如说你的抗原抗体啊，或者你的那个细胞就可以去刺杀它们啊，这个是不一样的。那具体在谈的时候就谈很多。那么毒副作用呢，有可能是病毒本身，这种可能性非常非常低。大部分根据目前的疫苗研发的历史，都是它的一些辅助剂。所以正是因为这样，所以疫苗反应往往是过敏反应比较多，而且是过敏体质的人容易发生反应。好在就是过敏体质的人，他的过敏反应大部分情况下，他的发生的情况都是非常及时、非常快。一般来说，你接种疫苗在接种后的半个小时，你待在医生边上，如果没事，大部分情况非常严重的事情就可以避免掉了。你像那种比较严重，就像有人对青霉素过敏，一针下去，可能大部分情况5分钟之内就会发生过敏反应。如果没有反应，基本上也就没有反应。剩下的那些什么发烧啊、疼痛啊，有的时候甚至有些面瘫有报道啊，那些可能我对面瘫还没有好好去研究，其他的呢都是往往我们叫做一过性的那种过敏反应。其实你如果了解到这些东西本身并不是可怕，你就是做一些对症处理。一般情况下，你就吃一些泰诺啊，就是说你降温药，然后或者吃一点这个就是止痛药，基本上就可以了。由于时间关系，我可能疫苗本身我讲的不是讲的那么多或者那么详细。那这个就刚刚讲的，它如果你接种疫苗之后，那么它的这个临床数据，对不对？辉瑞疫苗，那么它是已经有4万多人接种过，那么它的保护效力就是根据你都是在感染的情况下，有多少人发生这个阳性反应，有多少人是阴性的，那么你对照一下，这些常见的不良反应，后来就是从美国怎么审批的。那么它2020年能够生产多少？2021年能够生产13亿剂，这是预计。那么这边是莫德纳，也是 mRNA 疫苗，就是或者叫做核酸疫苗，它的保护效力差不多。那么这个就比那个辉瑞疫苗稍微晚一点点，但它里面有一个最大的区别，就是它的研发过程当中，它可能是辅助剂的不一样。所以说，辉瑞疫苗一定是在摄氏零下-70度，是摄氏啊。那么莫德纳呢，只要摄氏零下20度就可以，但是这个就在运输和储藏过程当中就会发生问题。如果你没有能够保证它的这个足够的温度，那么疫苗有可能就无效果，它可能会失效。有报道说有一个这个药剂师就把一个疫苗从冰箱里面拿出来放在常温里面，然后又再放回去，那这样的话你根本看不出来，但是你打的时候就没法打了。那这个还有一个张文宏的疫苗，我由于时间关系我也不讲了，好吧，也不放，我回头在这个 Q&A 的时候可能也许可以讲一讲。我大概就粗粗的讲这么一点东西，因为时间关系呢，我主要是针对大家有问题的时候我就多问一点。这个图片就是说我们大家让世界充满爱，那个就是说不管我们生活在哪个地方，讲哪种语言，对吧？我们相互之间多沟通多了解从科学角度去出发，就能够提高保护作用。那么这个是我父亲写的为了我们这次讲座。So my father just used the Chinese calligraphy. This is show Chinese calligraphy. Meaning if we united together, hands in hand, we can fight and beat the COVID-19. And this is another one I say, you know, the love, there's no boundary for the general love. That's my dad. And that's why, you know, meaning, you know, you should have the high level of ethical, you know, you should have the broad, big heart, and then you should be able to take the responsibility to do things. That's my understanding, okay? This one, very interesting. It's a Chinese poem and generated by my dad. It's called, you know, even we are locked down, isolated, but our communication, our emotion, our caring will stay forever. Even like here, we use WeChat, right? Very popular in China. And then we can use a text message, okay? And then so we can still stay connected. And my dad especially say, you know, may all the American people, you know, you can defeat the COVID-19 as early as possible, so you can get back to your normal life. This is just showcase our Troy PTSA. I really, you know, like Yulin help us to manage a lot of things. And this is the group. Here's Yulin. And this is still current president of Troy PTSA, stand for Parent Student Teacher Club. So believe it or not, I just want to share this one. This lady, Emma, she is already at her age of 85. She still serve on the Troy PTSA, and she already had her grandchildren. And on a daily basis, she still down the road works the students across the street. I really admired a lot of people. Here is their principal of the Troy High School, Dr. William, and this is the associate president. I'd like to take this opportunity to share everybody, especially in particular, iExplorer Club and Troy PTSA, and I'm serving part of the SABA, stand for Sino-American Biopharmaceutical Professional Association. And I'd like to take this opportunity to thank my parents, my guardian, my tutors, all the teachers from elementary all the way to my postdoc, and my classmates and all my friends, no matter where you are right now. Even we are isolated, but still to a certain extent we stay together. And this is a symbol for the vaccine to beat the COVID-19. This is my family. So my mom-in-law and my kid. So we made this homemade masks donated to the you know, charity organization. What is the name of the charity organization? Yeah, Care Mission, and we make the face shield, also donate to the community. So that's my slide. I'd like to thank everybody for the sake of time. And now we can save some time for QA.
Thank you so much, Dr. Wang. Now we're going to have questions. So our first question is, how long does the effectiveness of the vaccine last? Okay,
so I'm going to respond to what kind of language you use, and then I'm going to translate. The first thing, so far, it really depends. Okay, depends on which vaccine you use, and also depends on who got the vaccine. The accumulated data indicated at least the effectiveness of either the mRNA or the inactivated virus vaccine. They can last at least so far, maybe for several months. Let's just say half year. And whether they can be effective longer than 1 year or two, I tend to be conservative. I'd say it would be like expected to last that long, but only the fact, right? Because you know the vaccine is still very young right now. You think about even you consider the early days, the people invented or generated the vaccine. So I'm not so sure, but it's kind of promising. At least it can last several months. So 这个问题就是说疫苗有效性到底多久？我个人理解应该是。根据过往的经验来说的话，疫苗的有效性，因为这个疫苗刚刚研发也不久，对吧？到目前为止，新冠疫苗没有一个超过1年的，如果没搞错。中国有一种说法说，他们很早，大概是在2020年3月份左右就疫苗，但是欧美这几个疫苗真正出来的时候，大概也是在5、6月份到现在，所以也只有半年时间。所以基本上说半年可能是有效的，但是是不是2年以上有效？我个人理解。我们现在只是说这乐观估计，但是还要看数据说话。 So this is only general speaking. Go to one individual, it's hard to say, right? 就是如果是每个人你身上的疫苗到底能够维持多久，还跟你自己的情况有关系。还有一个它的保护力只有90%几，也就是说你尽管你打了疫苗，不代表你真的就不会感染疫苗不会感染病毒，对不对？只是说它一个百分比，你的感染的可能性会显著的下降。So the protective rate is not 100%. Even you get infected by the vaccine, there's still chances you will get infected by the virus. Okay.
Okay, thank you for that very thorough response. And so our next question is, will the mRNA vaccine affect someone's DNA over time?
Okay, I do not believe so. Number one thing is that, in order to address this, you need to have some biological education, at least at the maybe high school level. But I try to make this simple. mRNA, like the virus in general, okay, in this particular virus, they're not going to go to the nucleus, meaning, in the minimum unit is cell, right? Within the cell, there's an organelle, it's called a nucleus. So this virus is not going to go to the nucleus. So it's not going to interact with the DNA. DNA normally only resides in the nucleus and also in mitochondria. Normally, another organelle is called a mitochondria. So the mRNA is not going to go to either the nucleus or the mitochondria. So it will stay inside the cytoplasm within the cell. In general speaking, it will not interfere with the DNA because DNA only resides in either the nuclear or mitochondria. So 我稍微翻译一下，有人问就是说 mRNA 这么一个东西，遗传物质，它会不会影响到人体细胞的 DNA？ 那么这个我认为要回答这个问题，这个听众至少要有高中以上的这种生物医学的知识才能理解这个问题。人体的最小的器官叫做细胞，细胞有一个膜，然后里面有个细胞质，里面有各种各样的叫细胞核，还有一个叫做线粒体。在细胞里面，正常的人体细胞里面，只有这个 DNA， 就是它的双链的这个叫脱氧核糖核酸叫 DNA double strand 的DNA。那么它是在细胞核里面和线粒体里面。那么你的那个像这样特别的，像这个特殊的这个新冠病毒，它进入细胞可以，但是它不会进入细胞核或者是线粒体，所以常规里面它不会去影响你的 DNA 也有一些病毒它是 DNA 病毒或者 RNA 病毒，它可能会进入你的细胞核到细胞核或者是线粒体。真正的你不用害怕，其实我们身体里面，我们的遗传物质里面，由于进化，我们有很多的病毒片段就在我们细胞核的 DNA 里面，就在我们的遗传物质里面，但是通常情况下，它们都是隐藏在那儿，它们跟我们是人体是共生的。So on the other hand, there are some pieces of the mRNA or even DNA, depends on which virus we talk about. It can intrude into the nucleus or even mitochondria, and then it can integrate into our genome and become part of the genome. But they live together. They become silent or latent because of the evolution. We talk about maybe millions of years. So in general speaking, they're still safe. But in particular to this question, no. The short answer is no.
Thank you. And so the next question we have is, how safe are the vaccines?
Okay, how safe? Again, I can only speak based upon my understanding. We cannot go like a 100%, right? I would say majority in general, majority of people when they get the vaccine, you will be safe, considering there's still a different huge spectrum of the side effect. The most significant one maybe even cause death. But in majority, you always talk about the majority spectrum, right? I would say at least maybe 90% of in the human population, once you got the vaccine, you will be fine. But among this remaining maybe 10%, I'm not so sure about the exact percentage, especially if someone already showed the allergy, to like penicillin or some other allergic material. You tend to get more severe reaction. But even that, as long as you stay with the with the doctor, they have the specific regimen to counteract the severe side effect. Most of cases, I cannot say maybe 1 out of 10,000 something maybe become a little bit severe. Majority should be fine. And this is still case by case. You have to balance the potential benefit versus the potential risk when you compare getting the vaccine versus the chances you'll get a COVID-19 infection. So you have to always, we call this informed consent. 下面一个问题就是说，这疫苗到底有多安全？那我的意思就是说，它总体上来说，它的安全性还是很高。那么就看不同的比例。我大概说，可能大概至少接种疫苗之后，我个人认为至少90%、95%以上是没问题的。那么剩下的那个5%，甚至1%，甚至1/1000、1/1000，有可能有个别的。到目前为止，新冠疫苗如果我没有搞错，大概只在研发期可能有2到3个死亡病例，但是是不是真的是新冠病毒引起的，还很难讲，因为有的时候它是一个半生现象。Okay, just pause here. Let's try the next question.
Okay, thank you. The next question is, which mRNA vaccine is the most effective?
So far, my understanding, we only have 2. Maybe there's some other vendors or companies developing new mRNA. But if you boil down to the mechanism, they're almost the same from the genetic point of view. Maybe the manufacture quality a little bit different. It's called adjuvant. 就是的免疫的这个 adjuvant is part of the vaccine. I think they're very similar to each other.
Thank you very much. And so the next one says, how is aspirin related to the vaccination? And they're talking about the adverse effect versus the injection site, bleeding or other bleeding.
Did you mention the aspirin or what?
Yeah, they mentioned aspirin.
I don't have an answer. If you talk about aspirin, aspirin is the drug, right? ASPIN?
Yeah, ASPIRIN, yeah.
Right. Aspirin is a... Sorry. I'm coughing a little.
Jason, you're still muted.
Maybe the time make me a little bit very difficult. Can you hear me? Yeah, so aspirin, I have no clue whether it has a severe interaction with the vaccine. My assumption should be no, because aspirin has been widely used as a typical kind of antioxidant or help with the heart disease. If it does have some interaction with the vaccine, it should have happened long time ago, because again, we have different types of vaccine. So the only mRNA vaccine is a little bit new, but I see no reason that they will cause severe interaction and damage the body. 所以下一个问题就是说，有人说阿司匹林会不会影响这个疫苗，或者是有什么相互作用，导致这个疫苗效应下降，或者是毒副反应增加？我本人不是这么理解的。Next question.
下面一个问题是中文的问题，说 COVID-19 的来源有各种传说，有人说是来自自然界，有人说是来自实验室，请问其来源有定论吗？在不同的季节传染性有不同吗？
病毒本身可能会来源 是自然界，也可能会来源于实验室。但是据于我本人来说的话，因为这个跟来源没有太大的关系我们从科学的角度来说，它可能从什么地方过来，因为病毒可能会变异，也可以用一些遗传工程进行改造。但是我只能就事论事，因为我们的接受的信息有限，我在这里面不能做过多的评论。因为现在或者说现在我本人没有能够拿到让人信服的证据说这个病毒一定是从哪个动物身上过来，因为有人说是穿山甲，有人说是蝙蝠，有人说是有一种是什么水獭之类的有这种说法，但是我本人没有得到这么明确的这种来源的证据。So the question is that, where is the real origin or source of the virus? So far, there's a lot of rumors, okay? There's a lot of news, but everything should be fact-based, science-driven. To me, I have very limited access to the information, so I cannot make any definitive conclusion. Oh, this virus is really from certain animals, or from the field, or from the nature, or it was part of the artificial, genetically engineered. I do not have any evidence. So use your mind to collect more data, more fact. Maybe you can make your own judgment. Thank you.
那他第二个部分的这个问题是说，在不同的季节传染性有不同吗？
在病毒在不同的季节，应该说传染性是不同的。原因里面的确是跟温度有关系，这点是没有错。因为有些病毒它是温度敏感型的，所以说大家也能够看得到，基本上冷天它可能病毒死灰复燃的可能性比较大。因为这个病毒它的确是耐低温不耐高温的，大部分病毒也是这种情况。虽然说我们在南加州，我们这个地方气温相对高一点，但我觉得你看像典型的在亚洲，现在有这种可能性，好像这个疫情又有点像上来的那种样子。So whether the pandemic or the virus pandemic getting worse depends on the environmental temperature. I say at least it should have some relationship. The colder the weather and the higher infectious or spread the rate, because the typical COVID-19 virus, so far as I know, it can tolerate extremely cold temperature, low temperature. It is very sensitive to a little bit hotter. If I remember correctly, like anything over maybe 45 or 50 Celsius degree, the virus cannot survive.
Thank you very much. And the next question is, if the virus changes, will the vaccination still be effective?
Okay, now the typical terminology is called mutation. It's hard to say because depends on how significant the mutation, how significant the virus changes, okay? Because your current vaccine only target specific strains of the virus. If the mutation changes dramatically, causing high level of change to escape the vaccine protection, the protective rate or the effectiveness should be reduced. That's why we have to closely monitor it. So far, my understanding, the different variant or mutant of the virus, it caused the infection rate increased, meaning more people are prone to get infected, but the pathological efficacy or the effect of the threat or severity once the person got infected is not significantly affected, meaning it's even seen the trend that the current trend, more people get infected, but the people show less severe symptom, so the death rate may be even dropped. 所以下一个问题就是说，那么这个突变的病毒，它对人体的伤害会不会有改变？那么这个疫苗病毒突变以后变化以后，疫苗的保护作用是不是失效了？那我是说，从科学的角度，主要就看它的病毒的突变的程度有多大。大部分的病毒突变我们叫做点突变，就是说它的这个编码当中只会造成一个核苷酸的改变，位点的改变，它可能会造成 所变异的氨基酸的改变，那么就看这个氨基酸在这个整个蛋白质当中的位置。如果它的重要性，它的突变的重要性改变，那么有可能就影响到你这个病毒的就是疫苗的保护效果。那么所以说它的突变有好多种，有的甚至会一下子增加了很多的核苷酸，或者是在减小核苷酸，或者是重组。那么这个就看它到底程度有多大。但是目前的证据发现，大部分都是点突变，也就是说导致的可能你的蛋白质这个刺突蛋白质当中个别的氨基酸发生改变。如果发生改变的氨基酸的位置不是那个病毒侵犯人体的重点部位，它的那个侵犯力的话，那么它对人体的损伤，以至于或者说对这个疫苗的保护力影响不大。但是从科学的角度来说，很难讲。这就是为什么 This is why the common flu every year we have to develop a new vaccine, because the flu has a different type of strength. Maybe we have a different impact on the human body. 这就是为什么流感病毒我们每年都要重新打新的疫苗，是因为第一个疫苗不见得能够保持那么久，第二个它病毒变化很大，所以我们要针对今年可能是什么样的新的流感病毒，我们研发出这种针对性的疫苗。Thank you.
Thank you. Next question is, can I take both vaccines, the RNA and non-RNA?
Oh, that's a great question. To me, it's hard to say. So it's hard to say whether you have the RNA and the non-mRNA together. Scientifically, if you got a virus infection and then you inject the mRNA, it only trigger the body to produce more of the S protein in addition to the adjuvant. So I do not see any reason that the combination of both vaccine would cause a severe like a side effect. But I don't know, because it would depend on the data, the outcome we collected from human being. Again, I just try to be a little bit conservative here, because it's not a simple thing. It's complicated. You know, you have the non-virus, you have the non-mRNA virus, meaning you already got infection, right? You also think about even you got disease, whether you should still get an infection, you still get the vaccine. I think if you already have the infection and you inject the vaccine, I do not see any very bad thing. Again, considering only the side effect is caused by the adjuvant, and the adjuvant normally is not a big concern. 所以就是说，如果你一个人打2种疫苗，会不会有很严重的毒副反应？我只是做一个大胆的预测，我觉得有可能会有，但是这样的毒副反应只是可能是一些辅助剂，而不是疫苗本身。为什么这么理解？是因为如果你人已经感染了新冠病毒，然后你打的那个 mRNA 疫苗，你只是打了个 mRNA， 那你生产出来更多的刺突蛋白，那刺突蛋白难道就会再加上你原来感染，就会对你这个人损伤更大吗？我本人不是认为它有个叠加作用，但是这个需要科学数据去证明。就是说，当然现在我知道，任何一个国家都没有推荐你同时接种2种病毒。So far as know that there's no country, the regulatory agency recommend that someone should get different vaccines. Even you talk about same mRNA vaccine, seems like there's no reason you got one and then you get another one. Of course, if you stack them, maybe the protecting rate dropped. Later on, you get the secondary dose with a different vendor or different even types of vaccine. That still make a little bit sense. But again, nobody, as right now, there's no data. It's only everything to me. I would call this a guesstimate or assumption. Thank you.
Thank you very much. The next one is talking about UC Irvine just developed a patch that will work on any variant of the COVID virus. Is it based on RNA or non-RNA?
When you mentioned UC Irvine, right? Can you repeat your question?
Yeah, UC Irvine just developed a patch that will work on any variant of the COVID virus. Is it based on RNA or non-RNA?
Sorry, it's new to me. I have not studied it yet. It sounds interesting. 所以他说 在加州大学尔湾分校研发出一种新的疫苗，这种疫苗说是好像对各种菌株都有效，那它到底是什么机理出来的？这个可能这个新闻我这2年一直忙没有去看，所以如果有机会我们看一看，我们下次可以讨论。Sorry, I have no clue because I have not studied this news yet.
Thank you. The next question is, kids under 16 are not going to get the vaccines for COVID-19. How are they going to protect themselves?
Okay, kids under 16 or 18 are not getting vaccine. That's the current status. The only reason, because scientifically there are 2 reasons. Number one thing is that, as we mentioned, interestingly, I did not mention, I should have expanded a little bit. The severity of the symptom or disease really depends on how your body, especially your immune system, interacted with the virus, right? Ironically, I use the word ironically, in this particular COVID-19 cases, the people with the weak immune reaction getting severe, bad, worse disease, okay? That's why for this particular COVID-19 virus, younger people, even they get the infection because they have very strong immune system, majority of the cases, they're fine. This can be tracked as early of 2020. That was a case reporting a Hong Kong family, a family of 5 individuals. Among these 5 individuals, there were a aged 10-year-old boy, okay? And if I recall correctly, the rest 4 people, they all showed a symptom. But this young boy showed no symptom until the boy was tested positive. Okay, so in this regard, the children, as long as they use the way, as we mentioned, Wuhan, the way you protect yourself, you should be fine. That's the number one thing. The second thing is because currently, so far as I know, at least for either Pfizer or Moderna vaccine, the only thing is because a lack of the evidence, lack of the data, because the earlier phase 3 clinical trial, they did not collect enough data from younger generations or younger children, young people, basically under 18s. But right now, they both working on expanded clinical trial to individuals younger than 18. So we just be a little bit patient, waiting for a more convincing data. This is one group of the individual. Another group of individual is the pregnant women. We still don't have the data whether the pregnant women should get a vaccine or not. So again, based on the science, only the data, only the fact will show how good it is. But personally, I do not see, from my understanding of the science, I do not expect a severe side effect of the vaccine, specifically targeting the young generation. Let me try to explain quick in Chinese. 所以有人说18岁以下的人打疫苗到底怎么样？现在因为在中美，至少在美国是没有推荐给18岁以下的人注射新冠疫苗。这里面主要有2个原因。第一个，这个新冠病毒它的侵犯性很有意思，它侵犯了人的身体免疫能力比较差的群体，比如说老年人，比如说有一些这个疾病，对吧？比如说心脏病、糖尿病、高血压体质比较差的人，有一些肥胖的人，他容易感染，容易发生病重。年轻人发病率非常低。这个早在2020年年初就发生，在香港的时候，一家人5口，4口人发病，唯一的一个10岁的男孩，他也是新冠阳性，但是他就没有发病。这就是这次这个新冠病毒当中，其实100个人当中，可能到目前为止会越来越多，可能60%、70%都没事儿，因为你自己身体就能够抵抗得过去。只是那些体质弱的人，他病情程度不一样。第二个是因为现在的临床试验，他在研发公司研发的时候，他们没有收集到足够的，甚至没有针对年轻人去做这个临床实验，所以现在他们在补做这方面的实验。所以等补做的实验数据出来之后，我们看看到底怎么样。但是从科学的角度，我不预测，就是说这样的疫苗会对这个年轻人会有严重的毒副反应，或者说它的保护作用就弱。我本人不是这么理解的。我借这个机会再 稍微回顾一下历史上的各种的大感染当中，非常奇怪，你们如果是看历史上面，人类有3次流感大流行，3次的流感大流行，那3次当中，我如果没有记错，至少有1次或者2次，大部分都是身强力壮的年轻人，他们反而是最后感染之后病程非常严重。那个时候是什么呢？是因为你自己身体的免疫系统识别这么一个侵犯者，产生一个过激反应。所以这个过激反应，它不仅去打这个病毒本身，它甚至会把自己的身体的某些东西或者病毒造成的东西当成敌人，反而来攻击自己的。这种东西像在癌症里面也碰到这种情况，它本身应该是攻击癌症的，但是它激起了严重的反应，所以它甚至这种反应它会攻击这个患者自己。所以在历史上大流行的时候发生过这种情况，身强力壮的感染之后反而是比较惨。那么你在肝炎病毒里面就有个最典型的例子，甲型肝炎一旦发生之后，身体的反应非常重，然后呢，它就会甚至就它虽然它是那种传染到的那个消化道的病毒，但是它就是病程非常严重，就会死，很多人当时就会死掉。但是乙型肝炎这个病毒到目前为止，大多数人感染之后，它其实没事儿严重的、长时间的会发生慢慢的肝炎、乙型肝炎、肝硬化，然后发成乙型肝癌。所以全世界在70亿当中，如果我没记错，大概有将近15亿左右身上都有肝炎病毒。所以你我，尤其是我们亚洲人，可能肝炎病毒就比较多。只是后来由于研发了肝炎疫苗，所以这方面现在年轻人很早就打了疫苗。So I just use the hepatitis A and hepatitis B, for example. Okay, hepatitis A is one of the virus. You know, if people with a strong immune system might even getting worse, or the immune reaction is very quick. I may be wrong, okay? But comparatively, relatively, hepatitis B virus, many people, they get infected, there's no symptom. They can still stay very well. We call it a healthy carrier of the virus. But once the people, for whatever reason, their immune system got compromised, it can take years or decades to develop the liver diseases, such as progress to the liver cancer. Sorry, my longer explanation to your short question.
Thank you very much. That was a very thorough explanation. Thank you. Now, the next question is, which vaccine has less side effects, Pfizer or Moderna?
Okay, so far the report, based upon the report, seems to me the side effect incidence and the severeness is worse in the Moderna vaccine compared to the Pfizer vaccine. That's based on the information I collected so far. OK， 所以他的问题就是说，如果当你比较2种mRNA 疫苗，是辉瑞疫苗和马丹娜疫苗，哪种疫苗的毒副反应更重？根据我看到，因为我今天的时间我没有把这些 slide 通通秀出来，我看到的好像是说马丹娜疫苗毒副反应发生的比例比较高，相对来说它的毒副反应更严重一点。Regardless of this, majority of the vaccines, even you just collect all the report, because USDA, there's a website, you can report the side effect. To me, that's not so severe. The only confusing or confounding fact is about when you talk about their report in Norway, right? As many as like 23 senior individuals just passed away after the vaccine. I use the word, it's called after, okay? But whether it's really caused by vaccine, I highly thought about it. I'm going to challenge that because individuals at that age, regardless of vaccine or whatever, they might even pass away due to their pre-existing condition. So how can you prove the cause effective? Whether it's really caused by the infection? So far, it's very hard. 所以当你说如果有人新冠疫苗就是说毒副反应严重的时候，到底是他由于这个疫苗接种本身，还是说只是这个人群本身有问题？因为在挪威也有报道说，23个老年人接种之后是接种以后死亡，但是不能把它翻译成说因为接种而死亡。因为如果他不接种，他有可能由于各种原因，他可能也会死亡。所以你要做这个科学的判断，甚至是尸检其他的角度去真正证明它有没有因果关系所以一个伴生现象和因果关系。我打个比方，在美国 基本上 on average，OK， 在美国一年的平均数字，一年因车祸而死亡的人是36000人，那个平均下来一天会死亡100个人。那我今天跟你聊天聊了1个多小时，哪怕我们就算是聊1天，这是一个伴生现象。难道是因为 Jason 跟你们在聊天做讲座做了1天讲座，那里就有100个人因为车祸而死亡？他是因为车祸，跟我没有关系。OK， 这是一个 coincidence。You cannot prove that's a cause effective. Okay, you have to really find the scientific evidence whether Jason just chat with you for a whole day and then on average in United States, people died about as many as 33,000 individuals died because of the traffic. Okay, on average, about close to 100 individuals died because of the traffic accident. But I'm just exaggerating, make up a case. Okay, if I chat with Yulin or Ryan for the whole day, it has nothing to do. Those 100 people died because of the traffic. But if someone claim, okay, Jason, you caused the people in the 100 individuals involved in the traffic accident, and then they died. Come on, you show me the evidence. Why I'm just chatting here, I caused them to die because of the traffic. So there's no evidence to prove the cost effectiveness.
Thank you. The next one is, if there's the option to get the mRNA vaccine or the Chinese vaccine, which one should we get? Please elaborate on the safety versus the effectiveness.
So far, I have to make one correction. When you say mRNA vaccine versus Chinese vaccine, my understanding, partially it's true. The Western country, they use the novel technology to develop the mRNA vaccine, but which does not mean China is not developing vaccine using the mRNA. China, I did not get a chance to show you one slide. China used different technology to develop vaccine, but the most popular vaccine is true. They use the disinfected or how you say disabled, or crashed, or what you killed or tailed virus as the vaccine. But still, China still, so far as I know, some institution, they're still trying to develop the vaccine using mRNA. But if so, we boil down, compare the inactivated virus vaccine versus mRNA vaccine. I think that's the original question. If I try to guessing your intention, to me, at least from the control of the pandemic and from the purpose of the protect the individual, I would say if the data that we collected from the China's vaccine, because due to the fact that we don't see a lot of patients, COVID-19 patients in China because of the lockdown, right? So the pandemic situation is under control, is very good control in China for at least for the past several months, right? So the vaccine developed from China, they had to be shipped to the other countries, such as Brazil, right? Such as some other countries, and then to collect data to test the efficacy and the toxicity or side effect of the vaccine. I do not have a direct data from such kind of clinical trial. There are some report, but I'm not so sure how thorough that kind of clinical trial has been doing. I have no idea about the quality about the clinical trial. I'm only make the assuming that everything on the well control, because scientific has a lot of confounding factors, right? Assuming the data is true, then as long as you can cover the protection rate above like 50 or 60%, from the individual and the population or community point of view, the effectiveness is still good. But relatively, I would say, because the inactive virus still a virus, okay? But the mRNA vaccine, you do not see a virus. It's only part of the protein. I have more confidence on the mRNA vaccine compared to the inactivated traditional way of the vaccine from the short point of view. But on the other hand, we have almost decades of evidence that the inactivated or disactivated vaccine at least did not show a very strong side effect. So far, the mRNA vaccine for the protection of COVID-19, we only got so far the data, again, less than 1 year. Whether you will expect a long-term side effect, I have no evidence. But science-driven, I do not assume or expect a very severe side effect, even from the mRNA vaccine.
Thank you very much for that detailed explanation. The next
sorry,
one,
I have to maybe quickly explain in Chinese. Sorry.
Okay.
So 有个学生就问，就是说你比较就是欧美的 mRNA 疫苗和中国的灭活疫苗，毒副作用和保护作用怎么样？那么我首先就要澄清一下，中国实际上研发除了这个研发灭活疫苗以外，他们也研发各种载体的我如果没记错，什么腺病毒载体的、其他病毒载体的，或者是蛋白什么疫苗我忘了。然后就是说也有 mRNA 疫苗，只是他们还没有大规模的研发出来。那么如果说这个问题回到就经典的灭活疫苗跟 mRNA 疫苗，他们的利弊分析，我个人理解，第一点，中国的数据，它是因为中国自己病情不多，所以后来研发的疫苗，它只是在其他国家，包括比如像巴西这样的国家去做的。那么如果那些地方它是严格的3期临床试验来做，收集的数据是可靠可信的话，因为你做实验总是要用科学的方法。那么它现在显示它的保护率，有种说法是大概在75%，有种说法是在50%，有人说也是在90%。因为我们没有看到具体的数据，据我所知，我现在没看到数据，可能将来 WHO 可能有这个数据。那么只要你在60%以上，从个体和群体的角度来说，它保护作用至少是有一定的作用。那么 mRNA 疫苗，你是说这个辉瑞疫苗和这个莫德纳疫苗，至少从报道的数据，刚刚一个 slide 说它保护作用至少是90%以上，所以它毒副作用也不是那么严重。所以我觉得我本人，而且从科学的角度，他们那些疫苗本身并不带病毒，它只是病毒的一个蛋白，而且那个蛋白是你自己身体里面按照图纸自己生产出来的一个蛋白，虽然是病毒蛋白，所以它对病毒本身那个意义它不是那么严重。那么这个 mRNA 疫苗它的长期毒副作用到底怎么样？从理论上来说，我们觉得它应该会产生长期毒副作用，因为 mRNA 它在体内也不会存很久，我个人是这么理解的，所以它不久也会降解。这就是因为 mRNA 本身它就是很不稳定，那么所以它只要激发了一定的抗体和细胞免疫有记忆之后，它有一定的半衰期。但是 mRNA 本身它会不会就是说有长期的毒副作用？这个因为我们目前只有数据，到目前为止只有几个月，还没到1年，所以还有待。虽然那个辉瑞的 CEO 预测，根据科学的角度，他认为这个mRNA 疫苗可能有效期能够至少2年以上，但我本人表示 challenging，because 是因为我没有数据，你只是一个预测。谢谢。
Thank you. So the next one is saying, my husband is 50 years old with both high blood pressure and diabetes. Is it safe for him to get the COVID-19 vaccine?
I have to be conservative. I would say case by case, right? In this particular case, a male aged 50 with high blood pressure and diabetics, this individual should be careful. Consult with the physician first. I only make a recommendation, but based on my understanding, it still depends on even consider where this individual lives. Okay, if this individual has a high chance to get exposed to the vaccine, such as living in Southern California area, okay, for whatever reason, this individual had to get exposed outside, like, become an essential worker or whatever, and then I would highly recommend it to get vaccine. But if this individual living somewhere, like, one of my friends living in Tennessee, in the rural area, only stay at home, okay, with a good, family member to take care of this individual, I do not really think that, again, weigh the potential benefit versus the risk. To think about that, again, to consult with the physician first, and then there's always a chance, to beat the potential risk versus the benefit. Even given this individual decides to get the infection, get the vaccine, that's my recommendation, to stay close under the monitoring, post-vaccine with the doctors, because the doctors, they have some regimen. I forgot exactly the terminology. They have the anti-vaccine or anti-reaction shot kit. They can inject very quickly. If someone got the quick side effect or allergy caused by vaccine, they can inject the kit and to rescue the individual. So again, that's my kind of very generic recommendation. Because again, I'm not a physician. I'm not supposed to give a individualized like a decision. I'm not a decision maker. Thank you. 所以下面一个问题就是说，如果一个男生是50岁，又有高血压，又有糖尿病，那么他们是不是这个人要不要考虑接种疫苗？我说有2件事情，总体上来说你要利弊分析这个人如果是在疫情高发地区，对吧？他老是要出去会碰到，他接触新冠病毒的可能性比较高，那么没办法，他可能要考虑接种这个疫苗。但是如果这个人他是生活的地区本身疫情就非常低发，你在美国就有很多地方他疫情非常低。我的朋友在 Tennessee， 他就住在一个地方，就是讲个不好听，鸟不生蛋的地方，或者你很少看到人的地方，你也不出门，对不对？你家里面人也能照顾你，那你可能过几个月你都不太可能会接触这个病毒，因为这个病毒不太会在空气当中一路就飘过来到你那，对不对？那么你的那个接触食品也没有的话，那你这个时候也可以考虑暂时不打这个疫苗。但是如果你真的要打这个疫苗，像这个朋友的话，那他一定要考虑，就是要考虑他的这个副作用，那么尽量在医生的监护之下打。那么这种时候，总体上来说，因为医生对这个过敏反应，它有一些应急处理，它有一些针剂，就像这个对这个青霉素反应一样，它打完之后，它可以有，就像解毒一样，它有一个解效的。我具体细节我不知道，但是我知道有这个东西。好 ，Thank you. Next question.
Thank you. The next question is there any non-mRNA vaccine in the US that's available?
So far, for this particular COVID-19, the answer should be no, unless I'm making misunderstanding. Because again, because the science just advanced, the people in US or in the West country, they believe that the mRNA vaccine should behave better in terms of both the efficacy and the safety. That's my understanding. Yeah. So 下个问题就是说，在美国，尤其在美国，有没有除了 mRNA 以外的疫苗？据我所知，没有，是因为从一开始他们研发的时候，那些研发团队从科学的角度，他们认为 mRNA 的技术已经足够成熟了。因为 mRNA 技术，有人说在动物上面做疫苗已经做了很久了，而且 mRNA 技术做疫苗在针对肿瘤病人也应用过，所以这个技术本身不是一个全新的技术。拿这个再去跟这个传统的灭活疫苗相比的话，它有很多的优势，我还没讲，比如它的生产很快，它的这个它的这个效率很高，它生产的量也很大。如果病毒变异，它改起来也很快，就相当于叫什么量体裁衣，它很快就给你裁过来。Okay, next question.
Okay, the news mentioned that there is one oral vaccine being developed. Is this effective, and will it be available in the US? And is it mRNA or non-mRNA?
I just glanced at the news. Sorry again, I did not get a chance to check the detail. But my understanding, number one thing, it should still be mRNA vaccine, as so far as I know. Okay, maybe the only thing is about the again, that may be the adjuvant. Okay, because the reason you have to inject because of the mRNA one big bad side of the mRNA vaccine is that the mRNA is so unstable, okay, and then it can be destroyed very quickly. So that's why you have to design a way to protect the mRNA. They use called, I forgot it, maybe it's called a lysosome something to protect it. It's highly patented technology. I'm assuming even the orally delivered vaccine should still be based on mRNA, but there may be some other more creative patent-driven technology still can protect the vaccine so that it can be just swollen. But again, that's my assumption. I did not get a chance to read the detail. 下一个问题就是说，据说有人说有口服的这个新冠病毒疫苗，它的毒副作用怎么样？它到底是不是也是 mRNA 疫苗？ 那我好像只是今天还是昨天刮了一眼，但是我没有时间去看这个细致的东西。我本人认为，因为在美国他们就是研发的是 mRNA 疫苗，从技术上来说，它肯定也是 mRNA 疫苗，只是说可能它用另外一个技术去包裹了这个mRNA 这个遗传物质，使它稳定，那不容易降解。那这样的话呢，就是就是你打疫苗的时候就不用在这边打，而是口服进去，可能效果会更好。但是我本人因为还没看更多的数据，这个是可能比较新了。好，下一个 ，next question.
Thank you very much. The next one talks about, can you elaborate on the Johnson & Johnson brand? Is it safer?
Oh, Johnson & Johnson, sorry, I did not really study a lot of details. At least if I understand it correctly, it's not an mRNA vaccine. Maybe the claim I made earlier, it's not the thorough. Again, I have not checked the detail. At least there are different technology. There's a summary slide somewhere I did not put together in my PPT. Yes, there are different technology. Even they use the other virus as a vector, to we call it shuttle vector, to contain the part of the COVID-19 virus. There's a different technology. Either way, there's no perfect way. Either way has its own pros and cons. 就是不同技术研发的新冠疫苗，至少就我们所知，除了灭活疫苗、mRNA 疫苗，还有蛋白疫苗，还有腺病毒疫苗，还有其他疫苗，我忘了还有一个词，我因为没有好好去研究。就是说每一种疫苗它都有自己的长处，也有短处。由于时间关系，我也没好好去做这方面研究。事实上，有很多的免疫学家，我在他们的面前都是班门弄斧了。So I'm just a layman in terms of the immunology, especially in the area of the vaccine design or manipulate or development. So only based on the knowledge that I acquired so far, accumulated so far, and the news that I read so far. That's why I only share very limited understanding, and there might be still a lot of misunderstanding. And there might be also some errors. I have to apologize for those areas that I did not cover, or I just missed, or I made some misclaimant. Yeah.
Okay, the next question is COVID-19 similar to SARS outbreak in Hong Kong or MERS COVID in 2012 to 2013?
In general, basically, this is still the virus pandemic. So in that regard, there's some similarity. But the other thing is different because the strain are different, right? I don't recall what the strain are those SARS or the other pandemic. But my understanding, if I understand correctly, the earlier SARS, MERS, because the pathogenicity or the severeness of those virus even worse, even more severe than the one caused by the current COVID-19 strain, right? That's why the individuals who are affected by the other strains, the earlier strains, the death rate even higher. Fewer people can survive. That's the ironic part. The more severe the virus cause, and then the more individuals die, then the less chance, the opportunity that the virus can spread out. That's still reasonable, right? Because you have very less healthy carriers, or the carriers with the less symptoms or severeness. That's why you compare this against the hepatitis B. Very similar, okay? As I mentioned, you can talk about close to 2 billion in the populations are the hepatitis B carriers. Majority of them are still okay. Now back to this. So my understanding, the COVID-19 causing this 2020 pandemic, the pathogenicity or the severeness the virus caused is sitting in between. If you compare this against the early MERS, early SARS, or against the common flu, or the flu, or compare against the hepatitis B, it's in between. In the meantime, when we talk about the mutation or the change of the virus, right? The data or the information I collected so far is going to the good trend, meaning the mutation caused the virus easier to be spread. More individuals get infected and easier to be spread, meaning the higher, what is called, pandemic rate. But the individual infected by this newly acquired mutants, they show less severity. The death rate, the mortality rate is lighter or reduced compared to the strains that the individual infected earlier in 2020. So 用中文讲就是说，他说如果你拿现在的新冠病毒感染跟这次的、跟前面的 SARS、跟曾经在如果没记错在非洲的 MERS 等等之类比，那么它的这个致病性和传染性是怎么样？我个人理解还是这样，就是说很奇怪，病毒这种传染性感染的就这样。如果是你是高致病性病死率的病毒，因为它很快的就让这个受感染的人发生很严重的病，他就很快死掉了，所以你就会这种病毒它反而不会大规模的传染出去，因为你很少有些健康携带者在外面到处走，对吧？所以你想普通的感冒，你就大家都无所谓，感一次冒就咳嗽，对吧？你稍微对症处理就结束。但是千万别忘了，哪怕就是普通的感冒，没有任何一个有效的真正杀灭病毒的药，全世界没有。如果有人说这个药是治感冒或者治病毒的，那只是一个谎言，因为到目前为止我理解的真正针对病毒有效的药几乎没有。我可能稍微保守一点，我可能讲这句话，包括你说人民的希望等等之类的，其实它有这一类似的原理，但是并不是真正的去杀灭病毒，它只是降低病毒的复制和传播。那从这个角度来说的话，所以你拿现在的新冠病毒跟以前的 MERS 跟以前的 SARS 比，它的致病力不是那么强，它的病死率也不是那么高。现在所致的病死率是在0.1%到0.2%之间，也就1/1000到2%，可能某个不同的人群可能有不同的一样的，但是它跟普通的感冒或者流感比的话，也就是它的大概高这么几倍，不是非常非常高，所以说它的传播性还是比较强。根据现在的趋势，好像这个病毒的这个传染性、感染性更强，但是致病率、病死率更低，所以你可能发现更多的人感染，但是感染多的人不见得一定要住院到急诊室。为什么加州会出现这个情况？因为你基数太大了，基数太大了之后，那毕竟你有那么多人感染，我们的医院，加州的医疗系统是很有限的，所以还是就是说供求的问题，所以造成了这个加州的这个资源不够耗竭。Sorry, next question.
Thank you very much. Besides the epidemic date, is IgG or IgM or other cell immunity index, can they be the marker of effectiveness for this vaccine?
I would say yes. Because when we talk about the immunoglobulin, right, I forgot to compare IgM versus IgG. Here we may have some experts, there's some spectrum, there's some curve, okay? If I go to just assume one individual either get vaccine or get real infection, virus infection, the first immunoglobulin should be IgM. It shows quick response, but the curve is short. And then the later one, the IgG may go a little longer, okay, and peak later. Based on this, you can check from the level of the antibody, immunoglobulin, and also the symptom. You can use one of the indicator to see how effective that vaccine can treat. That's my understanding. I forgot which way go first or go later. There's a curve, okay? I'm just still assuming if my understanding is correct. For example, maybe the IgM can develop in some of 3 days once the individual got either vaccine or real virus infection, maybe only last for 2 weeks. But the IgG will develop maybe after 7 days later, the IgG level will increase and then will stay plateau, and then for even several months, and then will drop. So that's why for people, how to diagnose it. Sorry, I did not mention about the diagnosis at all during my earlier presentation. You should test, the diagnosis should be the combination of all this, like in the symptoms, and then the COVID-19 PCR-based testing right now, very popular. Then you can even consider to use the immunoglobulin like IgM or IgG testing. That's why Chinese government, when they try to recommend the individuals, travel across the country, they ask for both the PCR, mRNA, the RNA testing, and also ask for the immunoglobulin such as IgM or IgG test. 所以这就是说，它的问题就是说，你接种疫苗或者感染之后，你身体的免疫蛋白的水平怎么样？就是所谓的抗体反应。一个是 IgM， 一个是 IgG， 这个要有比较深的那个知识才能理解这个概念。如果我没有记错的话，好像是 IgM 它的反应更快，就是感染之后几天之内，它的 IgM 水平就上去了。那么它持续的不久，它也会下来。但是另外一个抗体，实际上在人体里面至少有7、8种，从什么 GM 到 F 啊什么等等之类的，我忘了这些具体的细节，因为我对免疫学已经忘了很多了，没有时间好好学。那么可能是 IgG 它的反应比较慢。但是它会慢慢的拉得更长，而且会它的水平会趋于水平，然后到坚持持续可能是几周甚至上月以后，它才慢慢下降。所以你去检测一个检测一个个体的时候，最完整的检测方法，其实除了 PCR 以外，我们今天没有讲很多的这个检测方法，除了 PCR 检测它的核酸，还要检测它的抗体水平，就是 IgM 加 IgG。通过这样一个组合，你可以知道这个病人有没有感染。大概在感染什么阶段 ？Thank you. Next question.
It has almost been 2 hours seminar, so due to the time constraint, we stopped taking questions. So that was our last question. Dr. Wang, is there anything else you'd like to say before we conclude the seminar?
Thank you again for your patience. I'm sorry, something I did not happen as I expected. I really appreciate again for Ryan. Your group, especially your club, has been doing fantastic job to educate even myself, to have the opportunity to educate myself, educate the community and serve the community, and trigger the scientific curiosity, ongoing thing, to be more creative and also to build up a more critical thinking. That's very amazing and impressive. And in the meantime, I really appreciate that Yulin, you are part of the Troy PTSA, and you spend a lot of time to help us organize things. We spend hours, not days, together. And I really appreciate all the audience sitting behind. I'm sorry I did not get a chance to really see each of your face. And some of you are my family members and my relatives and my classmates around the world, in Japan or from Canada, or from different states or in mainland China. And many of you are working, because we are all, many of us are graduated from Shanghai Medical University or Chinese Institute of Pharmaceutical Industry. And some of my friends are a member of the SABR, stand for Sino-American Biopharmaceutical and the Professional Association. I'd like to thank all of you and also my Shanghai alumni. Oh, before that, let me see if Dr. Xiguang Chen, can you please, Xiguang Chen is the chair of the Shanghai Medical Alumni Association in Southern California area. Dr. Chen?
Yes.
Yeah, can you please turn on your video? Yeah, thank you. Yeah, Dr. Chen, while maybe he turn on his video, he's...
it's not allowed to turn on the video.
Yeah. Maybe because the host,
maybe try now.
Okay, can you try again? Okay, thank you. We can see you, Dr. Chen.
Oh, thank you. I can see myself.
Yeah, we can see you. No problem.
Oh,
yeah.
Okay. Thank you.
Yeah. Would you like to make any comments?
It's a very good presentation. I am the chairman of 南加州上医校友会的会长。This is the first time I joined such kind of meeting. So I will be very much likely to participate in such kind of conference, education, And all our members of the Shanghai 医科大学校友会 we have a lot of expertise in different area in the medicine and basic science, especially for the life science. So if you need any help, and we can provide some kind of education and science. So if you have any question or need any help, so let me know. So we can organize more and more education sections, conferences to provide for the people surrounded South California.
Thank you, Dr. Chen.
Thank you so much for offering to help out with us. Thank you so much.
I also see, maybe just for the sake of time, I'd like to thank many of you. Sorry, I did not get a chance to read each of you, especially my former alumni, Dr. Juncai Xu Juncai, and some other friend, and Mr. Zhang Bing, and my former, I would say tutor, Madam Zhang Huijuan. Zhang Laoshi, 您好. So my former tutor, mentor, I would say, my former mentor is in the East Coast. Sorry, I do not want to take too much of your time. Thank every and each of you. And in America, I wish you good night. And in China, 在中国的朋友祝你们周末愉快。抱歉我可能讲的不是那么到位非常感谢你们支持这个活动。我们可能会把这个活动录像以后再分享给大家。We might record the entire session and we try to share, right?
Thank you so much, Dr. Wang, for your insight and knowledge all about COVID-19, the vaccine. Thank you, Dr. Xiang. Thank you so much. And thank you also, Dr. Wang, for the amazing calligraphy from your father. It was really beautiful, and I really enjoyed it too. Also, thank you to the audience for all the great questions. They really helped answer a lot of the most common questions I think a lot of people had, and it was really informative. We all learned so much, and it'll definitely guide us through this challenging time. And I wanted to say thank you to everyone who attended today's seminar. Stay safe and healthy. Together, we can beat COVID-19.
Yay. Thank you.
Thank you.
Have a good night. And 中国朋友祝你一天愉快。
Have a good night, everyone.
Bye.